Hello, everybody. Thanks for tuning in. Welcome to the Site Crusader. I'm starting to get a little bit of traction on this podcast, a little bit quicker than what I thought I was going to. So I'm pretty happy about that. So thank you, everyone that comes on, and in the future when you all click on my show and watch it, I appreciate that. For those of you who like my content, like, subscribe, and ding the bell. I'm not just a Joe Schmo doing this show, so. I do know a little bit about the field, more on the forensic psychology side of things. But, I feel like that with the state of the country, that there's a need for more, psychological personnel, counselors, school counselors. There's a need. And this is me doing my part. I work in the business world, so, this is just me utilizing an expensive college education in some sort of way. But I enjoy podcasting, so this works. So those of you tuning in for the first time, so I just had a book release. I'm going to throw that up there. So please, if you like to read books, I'm a book reader. I like to read books. I'm kind of a nerd when it comes to books. But this is my new book, The Swiss Effect. It's about how European politics plays a bigger role in the United States than what we think it does, and how that role isn't exactly in the best interests of America. So if you want to read my 1 year long investigation into that, I'd highly appreciate it. I plan on donating most of my proceeds to several different charities. So, if you buy the book, it'll go to a good cause. So there's that. It's available on Amazon, Barnes & Noble, pretty much everywhere you can buy books. So I'll take that off. Okay, so let's get into the bread and butter why we're here today. So today's episode is going to be about bipolar disorder. Okay, so this is bipolar disorder is a very, very tricky disorder because the signs and the symptoms all look like a little bit of everything else. So it's a little bit difficult. Like it's also kind of clinical depression. It's also kind of this and kind of that. So there's even a little bit of ADHD in there. So it's hard to really dial in, if someone really has bipolar disorder. But we're going to go define it. And for those of you tuning in for the first time, so I use for all my research information the Mayo Clinic because they're widely known. Everybody knows who the Mayo Clinic is. So if you don't like what I say, go sue them. I say that every episode. So you don't sue me, you sue them. But I'm not going to give you guys any medical advice. I'm just going to educate you on the signs and symptoms. And obviously, at the end of the day, you want to go see your psychiatrist or your counselor for further evaluation. So let's get into it. Bipolar disorder is formerly known as manic depression. It's a mental health condition that causes extreme mood swings. Bipolar, two poles. So you have a hot and a cold. It is basically the gist of it. And that's kind of the difference of why they kind of went away from manic depression, because manic depression didn't really define the two poles well enough. So they came up with a new name, and it was bipolar disorder. So in bipolar disorder, you're going to have emotional highs known as mania or hypomania. And we learned about that in the clinical depression episode a few episodes back about mania and hypomania. And then you're going to have lows, which is several different forms of depression. These mood swings they can be rare, or they can happen multiple times a year. It just depends on how severe or how stressed you are. All the factors that we're going to talk about here in a little bit as to how often you have episodes of your bipolar situation. When you do have an episode, they generally last. They could last a week, so you could be into this funk for up to a week. So you really have to pay attention to these signs and symptoms we're going to learn about. during this cycle is what they call it. People can generally have long periods of emotional stability. So you can have a cycle, and then you can go for a long period of time where you're fine, where you can live life like a normal human being would be a typical. So that is something that is common. Uh, and then you'll have another episode, and then you could go into another long period where you're just fine. So it just depends on the fact, like different factors that's going on in your life and how that all kind of pans out for you. I mean, bipolar disorder, just like several of the other, pretty much every issue that we've covered in this show has been, they're lifelong. There's no cure for bipolar disorder. So it's something that you have to learn how to manage it. And over time, most people do learn how to manage their own situation. So it's just mainly in the younger years when you're going through all these like ups and downs and they're happening so rapidly, and you have all these life changes that happen. You're both still adjusting to your own natural body's emotional changes to life. And so you tend to get caught up into the highs and the lows a lot easier, which could cause you some problems. So there is also a situation where you can develop both the mania and the depression at the same time. So you're developing this like high and low at the same time. It does happen, which enhances your bipolar disorder quite a bit, and it's going to make you very erratic. As you can imagine, it's trying to push two magnets together that are the same pole. They're just not. It's not. You can push it all day long, you'll get close, but it's just going to keep repelling. So symptoms. So you have bipolar 1, bipolar 2, and cyclothymia. So bipolar 1 is where you have like one manic episode that it could come before it becomes hypomanic, or depressed, like a major depressive episode. So you could have a major high or a major low. In some cases, the mania could cause a break from reality. And as somebody I've never been diagnosed with bipolar disorder, so it's one of the few I don't have. But if I had a loved one that did have bipolar disorder, I would be very that is where I want to watch. Are they slipping out of reality? Are they making sense? Are they losing their ability to verbalize and see reality as it is? So that's a kind of a big red flag for me, looking at people who do suffer from bipolar disorder, is how do we identify those signs and what do we do when we see them? And so I think that's one of them that we really have to pay attention to when they start to kind of seem discombobulated as to what reality is and the way that things are happening around them, and they're not seeing them correctly. So that's a big red flag, and we should be trying to, and we'll go. I'm not going to get too far. We're going to get into what to do a little bit later. So then we have bipolar disorder 2. Bipolar disorder 2 is if you had at least one major depressive episode and at least one hypomanic episode, but you've never had a manic episode. So it's where you're just like boom and boom, and there's no real like in between or like a mild. It's just one extreme or the other. Bipolar 2 disorder is not a milder form of bipolar 1. It's a whole separate diagnosis, and the manic episodes of bipolar 1 can be severe and dangerous, but people with bipolar disorder 2 can be depressed for longer periods of time. So we're looking at a chronic situation where you could be, anytime you have this period of length, then it becomes chronic. And it becomes more difficult for, if you start to slip out of reality for this long period of time, it's going to be extremely difficult to pull you back in. It's going to take a lot of therapy and a lot of meds and a lot of monitoring. So you, as people who have loved ones with bipolar disorder, or if you're able to self-diagnose and see your own signs, you really want to pay attention to that. You know, how long have you felt like this? And what has changed? That's why it's important. You hear all these psychiatrists and counselors say, well, why don't you write a journal, write a diary, or whatever. That there's a reason why they tell you to do that. It's not just to put it on paper. It's so later on, when you're comfortable, you can hand that book to them and they can start to see your behavioral patterns. Then they'll know how to better treat you. So I encourage everyone to do that. If you have a tough time verbalizing how you feel, write down how you feel. And it's gonna help. If you're willing to share those thoughts, it's gonna help with your mental health therapist. So here we go. We're into cyclothymia. If you've had at least 2 years or 1 year in children or in teenagers of many periods of hypomania symptoms and periods of depressive symptoms, you could be susceptible to that. These symptoms are less severe and more depressive. So the symptoms aren't as bad, but they're going to put you on a low. So you have to watch out for those kinds of things. It's not exactly the most, common part of the bipolar situation. So bipolar disorder can start at any age, but usually it's diagnosed in the teenage years or in the early 20s, just like we've talked on previous podcasts. Psychiatrists do not like to diagnose children at a young age because that diagnosis sticks with you forever. And if, let's say they're wrong, the brain is so powerful. If your psychiatrist is wrong and they diagnose you with bipolar disorder, but really you were just depressed for a week, that's gonna change how you view yourself. And so you're gonna manifest your own bipolar disorder. And that's how strong the brain is. And that's how tender they have to treat a child's mind, because it could cause some major issues later that they never had in the beginning. So sometimes it's just best for them to not diagnose. Wait for later when the signs are evident. So we're going to talk about mania and hypomania for a little bit. These are two different things, but they have basically the same symptoms. And we've covered these in other podcasts, but just to review everybody. So mania is more severe. It causes more noticeable problems at work, school, social activities, as well as getting along with others. Mania also may cause a break from reality. So there we are with a break from reality. But when that happens, then it's called psychosis. And we want to try to avoid having our loved ones slipping into like a psychosis period, because that is a dark tunnel that's hard to pull people out of. Treatment can be as severe as hospitalization when you get to this point. So in order to be considered manic or hypomanic, you have to have 3 or more of the following symptoms. Being much more active, energetic, or agitated than usual. So like if you're just like hyperactive. Number 2 is feeling a distorted sense of well-being or too self-confident. That could be a sign. Number 3, needing much less sleep than usual. I mean, I notice my own sleeping patterns, but mine comes from other issues. But when I have a sleeping pattern change, I take note of it, because I'm like, whoa, I only sleep 5 hours a day. Now, why is my body not wanting to sleep? You know, I'm only getting 3 hours of sleep this week. What's the problem? Why am I so restless? Or why did I sleep 12 hours? Like, I'd never do that. Why did my body crash on me? So you have to pay attention to your sleep patterns, because those tell a story as well. Number 4, being unusually talkative and talking fast. So if you're overall speech changes and all of a sudden you're an auctioneer out of nowhere, that could be a symptom. Number 5, having racing thoughts or jumping quickly from one topic to another. So that's a sign. It's kind of like talking fast, but you're just going from. It's almost like having ADHD. So, which we're going to discuss having multiple diagnoses, which is common amongst bipolar, where you tend to have a multiple diagnosis situation that could go along with ADHD. It could go along with clinical depression. So we just have to, kind of look at that and see which one does it fit. Number 6, being easy to distract. That's an ADHD thing. Hey, there's the Sarge. Welcome in, Sarge. It's been a few episodes. Glad you're here, though. Talking about bipolar today. Number 7, making poor decisions. For example, you may go on buying sprees or like take sexual risk, or make foolish investments. Something that you normally wouldn't do that's outside of your normal comfort zone. If you start seeing this as a friend or a parent or a brother, sister, you want to take note of that and start to see how, if this always is a situation that starts happening more frequently, because then that's going to be a problem. So next, after manic and hypomanic episodes, we're going to talk about major depressive episodes. So number 1, having a depressed mood, which is pretty obvious. You might feel sad, empty, hopeless, or tearful. Children and teens who are depressed can seem irritable, angry, and hostile. That I like to talk about the teenage portions of things a lot, because it's a slippery slope, because you're not only are you a teen and you have massive hormonal changes going on, but that can be masking, your bipolar disorder, or masking your clinical depression, or it could show a false bipolar disorder or a false clinical depression situation. So it's really something you have to pay very close attention to, because teenagers are going to have a lot of developmental changes in those years. So it's very important that we pay attention if we have teenagers around, and just see how they behave. Having a marked loss of interest or feeling no pressure in all or most activities, or no pleasure. So if you just stop, like you like doing this and all of a sudden you just don't do anything, you just sit around and do nothing, that's generally a sign, which could also fit clinical depression. So number 3, losing a lot of weight when not dieting, or overeating and gaining weight. When children don't gain as weight as expected, this can be a sign of depression, which it could also be, your thyroid slowing up and speeding down as you adjust to your hormonal issues. So that's not always the case. But definitely, if you're just eating normal and you're gaining weight or you're losing weight, that could mean something's out of whack. Number 4, sleeping too little or too much. Kind of the same as the manic and the hypomanic. Pay attention to your sleep patterns. Number 5, feeling restless or acting slower than usual. I get that way sometimes, where I'm restless. I can't, my body just won't get comfortable. And then I just, some days I just can't get to moving around, when generally I'm pretty active. I'm just zooming around everywhere. So, I have days like that. Number 6, being very tired of losing energy. You're just tired all the time, just nothing. You're just a nothing burger all day. Number 7, feeling worthless, feeling too guilty, or feeling guilty when it's not necessary. So that's something, if you start kind of developing this almost a quasi schizophrenia situation, where you're just panicking and you're worrying about things that aren't really worth worrying about. Number 8, having a hard time thinking or concentrating, or not being able to make decisions. That's a sign. Number 9, thinking about planning or attempting suicide. Now, here we go. This is where if you're seeing this, you're hearing this, or suspecting it, the time to act is now. You can't wait anymore. You can't wait and say, well, maybe it's a nothing. No, it's a something. And this is why a lot of our school shootings happen, because we get these kids in these situations where they have these mental issues going on, and everybody misses the signs because they don't want to look at them. And then a kid goes in and shoots up the school. And then everybody sits around afterwards and goes, well, how did this happen? Well, because everybody ignored the signs. So I urge you, when you see the signs, take them seriously. So the timing of symptoms, it does matter when it comes to bipolar disorder, because that changes your diagnosis. So you can have mixed, and that's when you have symptoms of depression and mania or hypomania at the same time. So that's a mixed kind of flow of things going on at the same time. And the second one is rapid cycling. It's when you have 4 mood swings in the past year, where you switch between mania and hypomania and major depression. So it's where you developed, like if you have 4 of them in a year, people are going to notice, because they're going to go, wow, man, just 2 months ago, that dude was great. Well, now he's like down in the dumps. And then 2 months later, you're going to be back flying high again. It's a pattern. When I watch people on Facebook, I see this a lot, where you'll see these people, they'll post life's great, and then the next month they're like, no one loves me, and then they're back to, life's great again. So I see that pattern a lot, especially on social media, when people like to tell the whole world how they feel. So bipolar symptoms, they can also occur when you're pregnant, you women out there. So pay attention when you're pregnant. Those are pregnancy mood swings, but you can develop a long-term bipolar disorder through pregnancy. Your symptoms can change with the seasons as well. So if you're bipolar, you could be on an up during fall, because you just naturally get happy with fall. But then winter hits and everybody goes into cabin fever. You could get depressed. So that the seasons could affect how your bipolar disorder operates. If you're like some people with bipolar disorder, you might enjoy the feelings of euphoria, and where you're on this real super high, and cycles like being more productive. But then you almost always have an emotional crash right after that. It's like you can almost call it. When you see somebody feeling so good that has bipolar, you can almost guarantee within a week they're going to crash hard. So when you start seeing that, start to get ahead of it as a loved one and try to kind of guide them down through that. That would help that out exponentially. That's what I would do if I saw somebody that I knew had bipolar disorder. I would definitely, if I see them on a real big high, I'm going to be prepared to, coach them into a soft landing. So when they do crash, it can leave you depressed and worn out, heavily fatigued. It could cause you to have problems getting along with others. It could also leave you in financial or legal troubles. So you can, it's basically like crashing out. Like you hit this euphoria and then you just crash out. A lot of people do that when things are so good in their life, and then like they just crash it for no reason. So that's something that you watch out for. So now let's go into the causes of bipolar disorder. Number 1, genetics. So bipolar disorder definitely is in your genes, and it can be passed down from person to person. There's no single gene that's responsible. Just kind of just pops up and it's there. So you also have your brain chemistry. Yeah, you might be, if you start to feel these things, Sarge, then you definitely need to start documenting what you're feeling and seeing, and that way if you start to have some really bad times, you're able to show this pattern on paper. I highly recommend people to write. That way, if you do have to go see a psychiatrist, you can just hand them the book and say, here, figure it out. And they'll sit down and they'll figure it out. They'll see your ups and downs, or, your long periods of depression. They'll know how to treat it just by reading your journal. They're very telling. Where was I at? Brain chemistry. So imbalances in neurotransmitters, like your serotonin levels, your dopamine levels, your noradrenaline levels, when those aren't balanced out, that's right, you do go to the VA, I forgot. But when you're like, all these levels aren't working right, you're going to have problems. Everything's supposed to be kind of on its own level, and it's supposed to just kind of go through your brain real smooth like. And so if your neurotransmitters aren't popping in order, that's when you start to see your symptoms come, and they hit hard. So, that's brain chemistry. Sometimes you're just born like that, where your brain's just not, your neurotransmitters just aren't firing in order. Environmental factors. I heavily stress environmental factors because I think most mental illnesses derive from environmental factors. I think since most of the issues that we've talked about on my podcast, they have very little understanding. Science has still yet to figure out how most of these happen. But I would put my yearly salary that these are generally going to come from environmental factors. I think we all have the ability to have these mental illnesses, but there's something that triggers it, or something that causes your neurotransmitters to get off. So that's my theory. And what I've seen, you can just about, in this one facility I worked at as experimental treatment facility, and that's what we did. We traced back trauma and behavior all the way back to the root. And then we found out that most of these mental conditions did in fact have a root. It wasn't something that they were just born with. There was an environmental factor that caused them to activate a certain mental reaction. And so we had to dig them all the way back to the root and try to cut that root out. I know it sounds kind of weird, but that's how it works. So environmental factors, like some things, it could be like a death of someone real close to you that can trigger things. Being a young child and seeing some violent situations, that is generally something that kind of starts to root up in your being. And then you have relationship issues. Most of mine are from relationship issues. I don't trust women at all. Just saying. That's one of my mental problems. So those are like some of the environmental factors that you can face that could trigger or worsen bipolar disorder. Extreme amounts of stress. Yes, Shauna, we're getting there. Treatment options. Or no, we're not in treatment options yet. We're going to talk about substance abuse. More than 60% of people with bipolar disorder abuse drugs or alcohol. So if you have bipolar disorder, you have a drug and alcohol problem, you need to get into rehab ASAP. Yes, Colin, women are the devil. I highly agree. Thank you. I second that motion. I'm waiting for Shauna to pop up and say something smart. But sleep deprivation, that's another one. If you are not getting enough sleep, it can trigger manic episodes. You can get depressed, and then you're like, sleep depresses me for sure. If I know I'm feeling bad, I'm just going to sleep my life away. And that's not going to be a healthy way to do it. Okay, so now we'll go into treatment options. So you have cognitive behavioral therapy, which is something we've talked about a lot on this show. It helps identify and change negative thought patterns and behaviors that contribute to bipolar episodes. So it's basically just sitting down with your therapist and talking about your feelings. this is how I feel. This is what made me feel that way, and how have I felt for a period of time. Then you have interpersonal and social rhythm therapy, and that helps stabilize your daily routines and interpersonal relationships, which can what Shauna says, reduce stress and prevent mood episodes. So sometimes when you just have an extreme amount of stability where your body and your mind can predict, because you do the same thing all the time. I'm very, very routine. If somebody wanted to assassinate me, it would be very easy. I do the same exact thing. But that routine allows my mind to know what I'm supposed to be going from point A to point B to point C. And it takes an immense amount of stress off of me because there's no guessing. There's no anxiety. Anytime somebody changes my routine, I get anxiety. So we have to, understand that people with mental disorders in general, an immense amount of stability or changing their erratic patterns is going to help them out. Stability helps. Family-focused therapy. So if you have a loved one, if you have a child or a brother or sister that has bipolar disorder, I recommend that you go to family therapy together. It's going to help everyone be on the same page. What are the symptoms? How do we deal with them? And when do we, when do things get serious? What do I have to do when things get serious? So you need to know these things with your loved one. So I recommend that you at least go through that therapy. Plus, it's going to help take the stress off of your loved one that's going through the issue, because they're going to see that you're the support person that they can lean on, that knows what to do. Yep, got to get into therapy. That's the hard part. Family members just don't want to take that time to go to therapy with you. But there's somebody out there that'll go with you, whether it's a family member or a close friend or spouse or girlfriend or your dog. Somebody will go. I recommend actual emotional support dogs. I have one somewhere, but she's not emotionally supporting me right now. Yeti. She's abandoning me. She's probably laying on the couch because she's not supposed to. Then there's psychoeducation. That helps people and their loved ones learn more about bipolar disorder, which can help with getting support and sticking to treatment, which kind of goes together with family-focused therapy. Number 5, we have behavioral therapy, which focuses on the behaviors to decrease stress. So if you're having bad behaviors, and that is part of the problem, Shauna. It is hard because a lot of people who have mental conditions, especially if they're alone a lot, but if people live on their own and they don't have any immediate family around them, it does make it hard for you to self-see your own issues. Like it's hard to see yourself in the mirror when you don't know what you're looking at. So that is a situation. But behavioral therapy. They're basically gonna what behaviorals are what trigger things are happening to you, and how do we avoid them in the future? That's kind of how that works. You have mood stabilizers, which is the medications. The big one is lithium for people who have a little bit more than a mild case. Lithium's it works very well. And then you have ECT, which is electroconvulsive therapy. We've talked about that. I think with schizophrenia, where they put you under anesthesia, general anesthetic actually, and then they just basically stick electrical waves through your brain and put you in a seizure. It sounds ridiculous, but it is effective. It kind of resets things. It's like shocking you and getting your heart to start again. That's kind of how that all works out. So then there's also the comorbid diagnosis. Where did my cursor go? Why do I always lose it? They need to make it a different color. The comorbid diagnosis is a dangerous situation, especially if the patient also has borderline personality disorder. It can enhance the aggression. That's what I was talking about. If you have a multiple diagnosis, one of them is going to enhance the other. It almost always happens. So but then in the same sense, it's going to mask whichever one doesn't get enhanced. So you're still going to have these hidden issues for this other disorder, but the multiple diagnosis is going to enhance the other one. So you have to. It's a tricky kind of thing that you have to be really in tune with the people around you, and your own self, and identify when you're starting to have negative thought patterns. Because borderline personality disorder can be extremely dangerous. Especially if you don't realize you have it, you're just thinking you're not thinking anywhere near close to being stable. So how do we help people with bipolar disorder? Should we just throw them in the dumpster because there's no cure, or there's no real, like, it's a lot of work to take care of someone with bipolar disorder? What do we do? Patience. It's going to take patience. You want to be open-minded and listen. So the stress is a big trigger for people with bipolar disorder, just like Shauna said. So when these people get to a certain level of stress, they're going to react in one way or the other. They're either going to get super depressed or they're going to lash out. So what you want to do, instead of interrogating them, you offer up an open forum for them, and you say, "Hey, let's just talk. You talk and I'll listen." And maybe ask them indirect, open-ended questions like, "Hey, what is it like having bipolar disorder?" Just let them talk to you about it. And a lot of times that'll alleviate that stress level just by letting them verbalize how they're feeling. It makes a huge difference. You also want to educate yourself, and we've talked about that several times already. You want to be as prepared as possible to help your loved ones with bipolar disorder. Patience is huge, especially when you're waiting on them to start medications, because generally your psychotropes don't start for at least 14 days. So you're going to have to be extremely patient until those meds start to activate inside their body. And then you have to be even more patient to make sure that they're even going to be at the right dosage to be effective. Because a lot of times the doctors just guesstimate and then they dial it in from there. So you got to hope that, it's going to be a somewhat manageable change that you can deal with. Encourage a routine. Encourage them to be very routine. Just like we said, if they have a straight schedule all the time, it's going to take stress off of them. Alleviating stress is the biggest key for people with bipolar disorder. Anytime you add stress to them, you're not going to get the reaction you want. You're going to get something very negative. Offer practical support. Like if they're in their routine and they're doing things and you want to further show them like your support, and say, "Hey, how about I do the dishes and you just relax for a second." If you offer yourself up in their routine and let them just take a break for a minute, that takes even more stress away from them. So that's always a good one. Be involved in their treatment if you can. Just like Sarge said, it's hard to get people to go to therapy with you because people don't like it. It's boring, or they don't want to potentially expose themselves to issues, which is generally what the issue is. But if you're able to be involved in your loved one's treatment, it'll help, as long as you know what's going on. Reduce their stress. Number 8, communicate consistently, even during periods, because people with bipolar disorder, when they're going through their cycle, they're going to generally push you away. So even when they're pushing you away, that's when we really need to, just buckle down, be patient, and communicate with them. And just be as supportive as possible. They're not always going to just open book to you. Yeah, I feel that, Sarge. Sarge said that, sometimes it just needs a vacation. And I think that's even if you have to go away for, a day, just do nothing for a day. Just sit by a river or something. Just be in nature. That's when I get really depressed, I want to be in nature. And then you want to practice self-care. That's important too. If you're absorbing everything somebody with bipolar has, it's going to tear you apart. So you have to make time for yourself to recharge yourself. If you're around somebody that has an excessive amount of bipolar cycling. So obviously, if the suicide prevention hotlines are important, if you know one of your loved ones is starting to slip away, then we need to take action now. Don't wait till later. Tomorrow might not always come. So make sure that you're doing that. If you have to self-check in and hospitalize yourself, there is no shame in that. Most companies will give you that leeway to if you're worried about hurting your job or whatnot. Don't risk it. Your life is more important than your job. Just be honest. Be honest with yourself, and you should be able to manage it. Be honest with your therapist. Be honest with your family and your loved ones. You should be okay. Also, just like what I always say, generally at the end of these is reach out to your faith system. When I get into a bind that I get stuck in mentally, I just pray on it, and generally I get the answers that I'm looking for. So if you have a faith system, reach out. It's not going to hurt anything to talk it out with a higher power. So, but that is going to be my show for the day. Probably going to get into something a little bit more dark and devious and complicated next week. So tune in, and we'll try to have a good time. All right, well, I'm out of here. Peace.